right. So again, my name is Jessica. I'm the childbirth educator. I'm also the lactation specialist, and I'm a volunteer doula for a different hospital, not for this clinic or this hospital. There's doulas that we have that are part of True Care. I'm not sure if you guys have met them already, but I'll explain in a moment what a doula is. That they are available for True Care patients. There's Monday through Saturday. They're in the hospital, and they can help in labor, which we'll be talking about today. But with that said, if you guys, and I'll talk about what we're gonna go over, but if I wanna kind of make sure you guys know each other first, so if you wanna just share your name, your due date, or how far along you are, whichever of the two, if it's a boy or a girl, and if you have a name, and also what would you like to take from this class, or what have you heard about labor? Actually, that's a better question. What do you already know or have heard about labor? We can start over here. Yeah.
Well, my name is Yasmin. My due date is May 23rd. Okay. It's a boy.
Yeah.
Yeah.
Do you have a name for your baby?
Ryan. For now, yeah.
Ryan?
Yeah.
Okay. And then if you don't mind sharing, who's going to be your support person?
My husband and my mother.
Okay.
Yeah.
I think, is it Ahmad?
Yeah.
Your husband? Okay, awesome. So baby boy, May 23rd, Ryan.
Yeah.
Okay, thank you.
My name is Jennifer. My partner is Alejandro.
Mm-hmm.
What was my name? Yeah, it's Jennifer and Alex. And what was the other question? I'm sorry.
Like your due date or?
Oh yeah, it's April 9th.
Mm-hmm.
And then we don't want to know what we're having, but a boy or girl is going to be named Sunny.
Oh, okay. Oh, that's fun. So it's Sunny is the name for the baby.
Yes, it's going to have a middle name, but we don't, depending on what it is.
Oh, that's awesome. And I think I forgot to ask, kind of go back, the last question is, what have you heard? What do you know about labor?
Well, I'm seeing like some videos. It's creepy. It's scary.
Scary?
Yeah.
That's
Yeah.
what, okay.
So, yeah.
Okay. And what about for you?
I haven't really seen, like I've seen videos, but just hearing from my mom's experience, my family, friends.
Mm-hmm.
But I mean, I'm just going with the flow. I don't really know what to expect or anything that happens.
Yeah.
Yeah.
So, if from your friends and family, what is their perspective? Like
everybody has their own. Every birth is different. I'd say that for some people it's like really painful. It takes a long time. So it was like they just push once and then the baby's out.
Okay.
So I've heard a little bit of everything, good and bad, and I mean at the end of the day, it's just.
And the epidural helps, right?
Some people that don't want it, some people that do, some people say it's bad, some people say it's, I've heard everything.
Okay. So I heard scary, pain. I think the other, can't read my writing, but I heard you say pain and maybe it could go fast, maybe it could go long. I think that's the word that I can read. It might be long. So those are kind of the things that are. What about for you, Alejandro or Alex?
Whichever works.
Okay. We know it's a we don't know boy or girl. It's Sunny, right? But what do you expect to take from today, or what do you already know about labor?
Last I heard, because at work there's another one. He's gonna go on leave in like 3 weeks for his baby. It's his third. He said it could take a while because he said his wife took 18 hours.
Okay.
And then he said if it's a natural birth that I had to like do a quick peek. That's gonna be gross.
That was his share that he
like,
saw the baby come. Okay.
It's gonna be traumatizing, but you just have to look.
Okay. Traumatizing. Okay. Okay. Thank you for sharing. So I heard pain, traumatizing, long. It can 18 hours. I'm just kind of putting all the stuff that I heard you guys say. Scary, epidural. That's all the things I've heard. So labor in itself is it's important that everybody's patient. So labor can be long, especially if the first baby, first time, and kind of going into like a doula. So what a doula is basically another support person in the labor. They can be there for some time or for no time if you don't want that either. It's a service that's available through TrueCare. Like I said, we have 2 of them. So they are there. So a lot of things that you're going to learn today, they understand birth. They kind of know how it is, and things that might seem scary. We kind of know, yeah, that's, she's probably in active labor. She's probably in transition. And all these things are going to make sense when we talk about them. But a doula is just an extra support person that can be there for you if you want it, if you don't want it. I like when you guys come to classes and you bring a support person, and if not, you can share this with your person. But because that helps them to be prepared on how are they going to support you and how they're going to be there for you. But yeah, labor does take a while. I mean, it can vary from 18 hours to less than that, but just be prepared for the first baby, first time. Long time can, from when the contractions start to when the baby's out, 24 hours is not uncommon. It's very normal. When it's a second or third baby, sometimes things go faster because the body knows what it's done. It's already kind of has memory. It's still doing the same process of dilating and the baby's going down and rotation, but the body kind of knows and it remembers, and that's why some second, third babies just are quicker. Pushing wise depends. Pushing doesn't always go faster second, third time around. Pushing can take from minutes to 3 to 4 hours. So that's just the pushing part. So today, just to kind of, what we're going to talk about, we're going to go over the signs that you're getting closer to labor. So there's certain signs to look for. Before that, we're going to go over the anatomy. So I usually write it down, but it's in my head. Anatomy of the cervix, of the uterus, of the pelvis, of what's going on while you're having contractions, while you're in the process of labor, and why that matters and why that it's important to know. So dilation is one of the things you probably have heard of before. I'm going to talk about how thick the cervix is, which is called effacement, and then where's the baby in your pelvis. So different things. And then from that, signs, how to know that you're getting close to the date. Maybe you're not going to have the baby then, but it's getting closer to the date. And then lastly, we're going to go over those 4 stages that you see on the screen. Up here is only 1 stage, but there's 4 stages in labor. I'm going to focus a lot on the first stage, which is when early labor starts, which your contractions are happening, changes in your cervix at that time. Active labor is when things get more intense, and the cervix is much more open. Transition is more intensity, and I'm very summarizing everything, but I'm going to go over everything. Second stage is pushing the baby. Third stage is the placenta needs to be delivered. And then fourth stage is the baby's on the skin. Everyone's recovering. Maybe breastfeeding is going to happen around that time. So that's all we're going to cover today. What questions do you guys have about everything that we're going to touch on? Is there anything that you want to make sure that I touch on or are you going to just kind of hear what you hear and then we'll go from there? Yeah. Okay, perfect. Okay, so let's start with anatomy first. So here we see a non-pregnant body. I'm going to pull something out. Didn't have it out. Oh, it's over there. Okay. So here on this image, we have the tiny muscle of the uterus. The cervix is right here. The birth canal, the bladder, the rectum. The space between this is the vaginal opening. So when we talk about pushing and baby's coming out, it's the vaginal opening, crowning. That's the last part of the whole process of labor. The space between the vaginal opening and the rectum, this is called the perineum. So when the baby is right in the vaginal opening and their head is coming through, that's the crowning. And some people probably have heard the ring of fire. That just means that perineum, that skin is getting stretched, and that's why it can feel like burning. but that's the last part from the whole process of labor. The pushing, like I already said, it can be a few minutes to 3 to 4 hours. The bladder, the pubic bone, so this pelvis, if we were to look at that same tiny muscle of the uterus, you can think of it's just very tiny, like the size of a pear before pregnancy. There's a lot of space, all the intestines, the stomach, the lungs, the breast is ready to produce milk. You start producing milk when you're 16 weeks pregnant, so you guys are past that point. You already have milk in your body, called colostrum, tailbone. So when a woman becomes pregnant, and you see it on that image actually, you see the same thing, but now there's a baby in there. On this image here, you see that tiny muscle. You see the baby's in this water sac, placenta, umbilical cord, baby's growing, amniotic fluid is in here. When we talk about the water breaking, that's what we're referring to, the amniotic sac that's inside of the uterus. This is only a 2.5-month-old, which is about 10 weeks. Here we see a 3-month-old, which is only 12 weeks, so 2-week difference. So we go from something pretty small to pretty big in 2 weeks. All their little toes and fingers and features are pretty present already. So as the baby grows, this is like a 5-month-old right here. That muscle is stretching, the baby is growing, the amniotic is also growing, and then we get to a point like this, right? So seeing it in 2 different angles, the same thing. We see that tiny muscle go from that to this, which is the same image, it's just a different angle. So we still have the same muscle of the uterus. This is still part of the uterus, that's the cervix. Now it's the neck of we call it the neck of the uterus. Birth canal is still there, like it was there already. Bladder, babies put pressure on the bladder as they're growing. That's why moms have to use the restroom very often. And the hormones of pregnancy cause moms just to have to go pee a lot. Back pressure or back discomfort is common because depending on baby's positioning, they put pressure on this tailbone or this lower back. Intestines have to move and, everything has to shift so that it makes space for the baby. So we go from something tiny to something like this, right? We're looking at the same thing, just in different ways. So that tiny muscle expands to make space for the baby, the amniotic sac, the amniotic fluid, the placenta, and the umbilical cord all in here, right? So when we talk about contractions, there's different types of contractions, but just in general contractions, when a contraction happens, we can think of it as a cramp. So a cramp in the muscle of the uterus. For men, you can think if you've ever had a cramp on your calf, 10 times more than that and happening in the uterus. And it's intensifying until the baby is born. So that's, if you I don't know what it's like, you ever had a Charlie horse and it gets, think of it getting more and more and more intense. As the cramp intensifies, the cervix is changing. And when we talk, have you guys heard of dilation? Yeah. How would you guys say what dilation is in your own words?
It expands with each like a stage. I don't know how to say it. Like it goes from like 1 finger to like it goes pretty big.
And we're talking about this part, the cervix. Yeah, so it's gonna open. Basically, it has to open up, and midwives will usually, or providers, measure with their finger. This will be like 10 centimeters. But anyways, that's happening and that's changing when a contraction is happening as well. And I'm gonna hold off on talking about contractions because I'm gonna talk about Braxenics versus real contractions. That's different. But this is just important to know what changes just happened, what's going on. Yeah, what questions do you guys have about just anatomy of the uterus, the cervix, everything else that we already talked about, amniotic fluid, placenta, umbilical cord. pelvis is part of it too.
Yeah, thank you.
Good. There's muscles in here as well. So there's what we call the pelvic floor muscles. So baby's gonna make their way through this opening, right? That's gonna open to 10 centimeters. But also baby's gonna make their way through the pelvis, and they're gonna make way through the muscles. So it's important to walk, stretch during pregnancy, and there's certain positions that you can do in labor that can help the baby's trying to be born as well. It's not just pain happening. The pain causes the baby to rotate and move and go down. So when we're having that, or when you're having that pain, your instinct might be not to do anything, but it's better to move a little. If you have a birth ball, you can sit on a birth ball. You can, move your hips around. You can stand and lean forward and do breathing. And I'm going to talk about the differences between what you do when labor is starting in the beginning to when it's getting intense. You might be doing something different. You might not be doing too much movement in the beginning, but later on it's better to do more movement.
What does it mean when they said that your belly's gonna drop, and that's when you know that it's also coming or something? I've heard it a lot, that basically it will like drop.
Perfect. We're gonna go into the science of labor. So
Okay.
perfect. Thank you for sharing that. That's actually the second thing we're gonna talk about. So we're gonna go over signs of labor. So what you just described, it's Jennifer, right?
Yes.
Yeah. It's a sign of labor that you're getting closer. So that's called lightning. So so your baby's pretty high most of the time. Your baby's pretty high. Most babies, I didn't say this, but most babies are on 34 to 35 weeks. If they haven't already, they're gonna rotate head down, or flip head down, and they do this to be ready to be born. So most babies will do this. You can help a baby though by, like I said, walking and stretching, and there's certain positions where hands and knees positions are really helpful. I'm kind of hands and knees positions more. So go like these. I think we've probably talked about them in the past, but being on hands and knees with or without a ball, with a partner, with the couch, these positions are awesome and important to do in third trimester, in labor as well. But these things can encourage a baby to be more in a better position. Head down, and once they're head down, we want them ideally to be more, what we call it, anterior. We want them to be facing your back, versus a posterior would be this, where they're on your back. So when a person is not very active, and we're just sitting like normal, lean back, a baby will tend to do this more, and this puts more pressure on the lower back, meaning that in labor it can be more back labor, contractions all in the back, more intense, more painful, and longer. So that's why the certain things that we do in pregnancy and in labor can be helpful to help a baby to be looking this way. If we're in hands and knees, we're helping a baby to want to do this more, especially with contractions, because contractions are moving a baby. But going back to the point, babies are pretty high. That, what you just described, Jennifer, lightning, can happen days, or really days to hours before, and the baby just drops further in the pelvis. So further into the uterus. That is when it's pretty visible. When you're pregnant and you're all towards the end, the baby's pretty high, so it's up here, the belly. So when they drop, it's noticeable because it can look like there's like a little table almost, but there's more pressure down here because the baby just dropped. That just means that you're getting closer to the due date. You may not have the baby that day, but it might be in a couple of days, in a few hours. It just depends. So yeah, and moms can feel more comfort, like I can eat more, I can breathe better because they're not all the way up here, but now they feel more uncomfortable down here because they either have to probably waddle, and it feels more uncomfortable, or the pressure down here. That's when the birth ball can be helpful too, because the birth ball is soft and it's not as much pressure as if you're sitting in a chair. So sitting in a birth ball, you're just kind of moving your hips, you're just hanging out, and it kind of opens up the space more. So that's one of the benefits of doing it early in labor or in this point, like third trimester. And that's exactly what it looks like, the picture you see right there. Have you seen that with people, or you just heard about it, Jennifer?
I haven't seen it, but I have heard of it.
Yeah. How many weeks is it again that you are? 34? 34? 27 and 30.
34.
So you're almost there. Yeah. You still have a little bit. But yeah, I mean, you could maybe start noticing like your baby's still pretty kind of high, and he's going to keep getting higher, you know, and then you're going to maybe notice a difference. Another sign that you're getting closer to labor is the water breaking. But before I talk about the water, another sign that can happen is the mucus plug. So we see on this picture, in the cervix, there's mucosal secretions that cover the cervix, so nothing comes in and nothing goes out. It's protection barrier. When you shed the mucus plug, which can happen weeks before or days before, it looks like snot, and it could be mixed with a little bit of blood. That's normal. That just means that you're shedding the mucus plug, you're getting closer. Braxton Hicks contractions are warm-up contractions. So a warm-up contraction is that not the entire uterus is contracting. It might be just parts of the uterus. Moms feel them more on the top and towards this area. A Braxton Hicks is just, it just tightens, and maybe it's uncomfortable, but it doesn't last very long. It's not every day. It's random. You can have 1 or 3 or 4 at night, and then you don't have any the next day. You have one maybe in 3 days, and you don't have any later on. And women can feel them since around 20 weeks. Have any of you guys felt Braxton Hicks? Okay. How do they? No. How have they felt for you?
They don't feel good. They hurt a lot. Last week, it was the first time I experienced like the pain. They're like every 5 minutes, and it was like about, I was counting them. They were lasting like about a minute, and it was like my belly felt very tight, and it would just go away. Like if you were like pushing or something, but without even doing nothing, and then again it was like tight, and then it was like I couldn't even move. Like it hurt really bad, and then just go away, and then it was like coming and going.
What helped with did you try anything to help calm them?
I couldn't really even move, so I just like waited right there on the couch till it went away.
How many did you have during that time?
It started like around 8 or 9 at night, and then till like 1 in the morning they stopped.
Oh, it was a wow.
So,
okay.
Yeah, and then since then I haven't really felt another one.
Yeah. Yeah, and I mean, and did you end up? You didn't have to go to the ER or anything. You didn't talk to your midwife after that.
I did talk to them the next day, but they said it was dehydration.
That's what I was thinking too. Yeah.
But I did drink a lot of water, but it said like maybe movement, or I don't know what it was.
Yeah.
I haven't had it since then, so.
Yeah, it's normal. So I mean, it's a way that your body. Thank you for sharing, by the way. But it's a way that your body is preparing itself, and usually, what they usually recommend is drinking water. If you ever feel any, like whether it's a real one or not, and you're not sure, always drink water, because water is going to hydrate the muscle of the uterus. Remember, it's a muscle. If you guys have, worked out, they compare labor to a marathon. So when you're in a marathon and you're using your whole body, you want to hydrate your body, or if you have lifted weights or anything like that, you need to make sure you're drinking water, because it's a big workout in this area. It is a big workout, and moms are usually exhausted after they have a baby because they just had a marathon of the whole process. So water is going to be what's usually recommended for Braxton Hicks or any contraction, and move a little bit too. Like that would be getting out. Maybe, if you don't have a ball, you can just lean over the couch and, do some type of movement, or go on hands and knees by the couch and, move your hips side to side. So movement helps to usually calm them down. The difference with a Braxton Hicks is that it'll calm down. real contraction does not go away. It stays for about a minute long. And so even if you do those things and you drink water and you move around, a real one is not going to go away. It's going to stay and it's going to continue to come. It's going to have a pattern. So when we talk about the first stage of labor, they just keep coming. You know, it's not very close together all the time. It might be that you get one at 5 a.m. and then you get one at 5:45 and then you get one at like, I don't know, 5:55 and then one at 6:10. So they have a continuous pattern, but they're more manageable. So what you felt is like a way to prepare yourself for the real thing.
It's normal?
Yeah, it sounds normal. And from like the confirmation she got from her midwife, yeah, it sounds normal. So water and movement would be helpful. Now, if your contractions don't stop and they keep coming and you're still under 37 weeks, right? You know, we want to try to, there's times that we would need to go to the hospital, you know, if the contractions continue to come, if your water breaks, those kind of things can signal preterm labor. And we definitely want to be cautious of not waiting, you know, and if they basically keep coming, and water breaks, those are pretty. And going into the water breaking, the water may not break, but if it does break, it's very unlikely that the water breaks. It's not like the movies that the water gushes and we run to the hospital and we scream, or they scream and they push the baby in 2-3 screams. No, the water it's unlikely. It's only 10% of women that their water breaks. So 90% of women, their water doesn't break. So really what you're looking for is the contractions, the intensity, and the pattern of the contraction. How intense are they? How long are they lasting for? They should be lasting for a whole minute, and that should be having a pattern consistently. And I'm going to explain how to time a contraction and those things, but if the water does break for whatever reason, because maybe it does, you know, you want to look for 4 things. So you want to look at the color. The color should be clear. It might have a little bit of yellow if it got mixed with urine, or a little bit of pink if there was some blood in there. That's normal. But if it's green and brown, that's not normal. That would be a reason to go to the hospital. The smell should be pretty much no smell, but if it has a foul smell with the color green or brown, we go to the hospital. Those 2 things can signal that the baby could have been stressed in the womb and the uterus, and they could have pooped, and now that's what's the first poop is meconium. So it could be flowing in there with them and they could be drinking it potentially. So that's why if we notice those things, color brown, green, smells off, weird, we go to the hospital, we don't wait. If those things are not present, it depends. The amount. So sometimes it's going to be a big gush like the movies, and sometimes it's just a little trickle of fluid. Here are a few of those scenarios, just like images. So just, you know, kind of signal. If it's a big gush, it just could have broken from a lower point and a lot of fluid came out. If it's it's just a leakage, it could be a higher break. And sometimes if moms are not sure, I don't know if it broke or not, you can always wear a feminine pad and see if it gets soaked. And if it keeps getting soaked, you know, and you can always call the clinic. You can call from working hours 8 to 5, let them know, like, I think my water broke. I've been kind of tracking it. If you have contractions, you tell them what's going on. That information, they'll take it and it goes to the nurses, and the nurses will follow up with you and give you medical advice. You can always go to the hospital too if you feel more comfortable, but it's always important to either call the clinic or go to the hospital if the water breaks. But if the reasons it would be an emergent situation is if it's brown, green, it smells off, we don't call, we just go to the hospital for those reasons. Now, there's a test that they'll do at 36 weeks called the GBS test. So that's testing for a bacteria called group beta strep. And if a mom has that bacteria, it's found in the intestines sometimes for anybody, women or men. But for pregnant women, if it's present, there's a risk that bacteria can travel into the cervix to the, where the baby's in. And so it can potentially pose a risk of infection. So if they tell you when they do that test, you're GBS positive, your water breaks at some point, you're just going to go to the hospital. They're going to give you antibiotics to help prevent infection for that, which is penicillin. So those would be the 2 situations that if the water were to break, it's best to go to the hospital. The other ones, it just depends, but always inform either the clinic or go if you feel more comfortable going. The water breaking is just, it's a sign that things are happening. It's not an emergency all the time, but there are situations where, yeah, we need to head to the hospital. So what I would say is just everybody needs to remain calm, even if the water breaks, you know, even though it's like, oh, things are happening. But yeah, that you have those two options. What questions come up about the water breaking?
It's a sign still.
It's a sign, but you always want to inform either the clinic or go to the hospital.
Mm-hmm.
But there are certain situations that you just want to go to the hospital. You don't want to wait. Yeah. Mm-hmm. Sometimes the water can break and there's no contractions, and that just means that the contractions are going to come within 1 hour or so. Yeah. So some people might call the clinic, you know, let them know, monitor if they want. The main thing too is don't go for many hours. It's been like, I don't know, 6 hours, 10 hours. Nobody knows. You haven't called the clinic. You haven't gone to the hospital. We also don't want to put a risk to the baby's losing fluid. So we also want to be mindful of that, informing someone clinical, and drinking water. If your water breaks, keep hydrating your body, and just being aware of those things that I already mentioned too. Yeah. Sometimes if it doesn't break on its own and you're already at the hospital, they can do what's called artificial rupture of membranes. So basically they use what's called an amnio hook. It looks like a crochet hook. It's a medical device that goes into the vagina, through the cervix. They get to the water bag, they'll nick it, and it breaks. And this is a procedure that they would do at the hospital. They would talk to you. They should talk to you about it if they're thinking of doing it, and you should give your consent of any medical procedure. This is just one of them. Breaking the water can make things sometimes go faster. It's called augmenting labor. So if labor's already kind of happening, things are moving, your cervix is dilating, you're having contractions, but maybe the baby's still up there because they're still in that water sac, you know? That could be a potential thing that they can say, like, we need to break your water. And have conversation. You can ask questions. You can say like, oh, you know, what's the reason that I need to do that? And what are my risks if I do it right now? Can I wait? Or is it better to do it? Like, have that conversation. So you feel good with the decision, whether you do it or not. So you feel good with the decision. Questions about that? Water. Let's see if I missed anything else. Another sign that labor is approaching could also be that moms get a lot of energy. So they feel like they want to start doing projects and they want to start moving things in the house. So if you see her trying to like move, I don't know, large furniture or things, be like, oh, it's called a nesting instinct. So moms do that when they get closer. So you could just tell her like, calm down, you don't have to do all that work. You know, she's gonna need the energy for the labor. But some moms do get a burst of energy and they start wanting to do more things or just get all the baby stuff together. Those are fine because they're gathering little things. But if it's big items, things that are gonna like really put stress on her, we might wanna like tell her like, just relax, you know, you're okay. I can do that for you, like the partner. Some moms might get the opposite. They might actually feel like they're having the flu and they get really sick and they just feel sick. They just don't feel good. That could also be a sign that it's approaching. Moms sometimes get diarrhea when they're in labor or they get into labor. So their body's trying to flush everything out. That's another thing. Yeah, those are some of the signs. Yeah. What questions? No questions? Yeah, I think I mentioned the main important ones, Braxton Hicks, just a preparation for your body. Mucus plug, water breaking. Water breaking is pretty clear that you're almost getting there. And the other two that I mentioned. All right. Now let's talk about labor. So not Braxton Hicks, but when labor's starting, and actually before I talk about labor more, I want to talk about what I was referring to, effacement and dilation. When we talk about dilation, we're talking about how the cervix is opening with the contraction, right? So there's three things that are important. It's not just dilation. Dilation is a marker because the cervix has to, right now it's closed, completely closed, right? Like that picture there. But when contractions start happening, the cervix is going to be going from 1, 2, 3, 4, 5, all the way to 10. This process takes long. It takes a while. That's why patience is super important. 24 hours is pretty normal. The first stage of labor is when contractions are happening and they're more manageable. So moms can start to feel them below their, like right by their lower back, and they go kind of what you were feeling, but a little bit maybe picking up the intensity. So on the lower back, it gets tight and it maintains like that for about a minute long. It's what you described was a perfect way to describe the contraction. So that's early labor, and then they come, and at the same time, while that uterus is cramping and tightening, the cervix is starting to soften. So when we talk about not dilation but softening of the cervix, in the hospital they call it effacement. So the cervix has to go to 10 centimeters. That's one marker. It also has to efface 100%. When you get to the hospital, they might check you, and they might be like, you're 3 centimeters, 30% effaced, -2. So these are markers to kind of know where the baby's at and what your body's doing. 30% just means that the thickness, the pink that you see on here, is still pretty thick. It has to go from bottle thick long to nothing, right? Here we go from 2 centimeters to 5. It's a big difference. So we want both things to happen, because we can't just dilate and open and the cervix is still pretty thick. It's not going to help labor, if that makes sense. So both things need to happen. And I say that because some women are fixated on dilation, and they might be like, oh, it's, I can think of a situation that I was with in December. When I was there with her, she was at 4 centimeters, and then I think only an hour passed, and then she went to like 5 centimeters. But she went a centimeter change, right? She actually effaced a lot. She was from 30% to I think 70 or 80%, but she didn't hear that. She just heard dilation, and she decided to get an epidural, which is fine. If you want an epidural, you get whatever. But, it's just something important to realize, that it's not just how dilated you are. And there's usually 2 protocol cervical checks in the hospital. The one when you get admitted, they'll check you, and the one right before pushing. Anything in between can be optional for cervical checks. But some women sometimes ask for them because they just want to know where they're at, because they want that reassurance. But sometimes just be cautious with that, because, if they check you and you're just, it's still 5 centimeters, maybe that could be discouraging for them too. And important that maybe if maybe the dad hears or the partner hears oh, but she went to 80%, wasn't she 30% effaced? Now she's 80. And then when I say number stations, the baby is also moving through the pelvis. So there's stations when a baby is high. The baby's going to be mostly up here for most of the labor. High means, negative station just means that they're high. So -4 to -1, they're pretty much in the top of your pelvis. When a baby, so that's what I say with that mom. She was 4 centimeters and she went to 5. She went from 30 to 70, I believe. And then her baby dropped a little bit. I think when I first was there, baby was -2. The baby I believe went to a -1 or a 0, I'm not sure. But that means the baby went down. So I'm saying these things and these medical terminology because it can help the mom, but it can also help the partner be aware of what they're saying, and they can share that. They can maybe tell that to the mom, hey, you're effaced. That's really, baby's going down. That's awesome. Not just looking at how dilated you are, even though it's also good to dilate. Negative station is a baby's in the most narrow part of the pelvis. So right here, right by the pubic bone. So they're in the most smaller area. Now that's why I talked about positions. There's certain positions that are going to help when a baby's up here, sitting on the ball, rolling your hips, maybe, leaning, going on your knees and just hanging on the ball. Especially if you have back pain or back labor, those are really good. Now a baby's lower, things are stretching more. So maybe moms are gonna need pressure on their lower back, and there's other techniques that if you guys take another class, we can review that. But putting what we call hip squeezes or presses on the sacrum. There's other things that can be helpful, or just laying down in a certain way in the bed to make space for this area can help a baby kind of do the rotation. When a baby's past the pubic bone, +1, +2, +3, +4, they're pretty low in the pelvis. So that's why I'm saying these numbers, because what if they check you and you're like, oh, baby's +1, you're at 6 centimeters, but baby's +1. That's the improvement. Baby's gone down. And that matters. It's not just about and I didn't even say this in the beginning, but there is pain in labor because it's a cramp, it's a big muscle that's cramping, but this pain has a purpose, and the purpose is the baby. And it's important to remember that. And sometimes support people will be the ones to remind them, like, baby's coming, this is good, Sunny, right? Baby Sunny. Like, you got this. And because in the moment, moms can forget, because they're so in the moment of the pain, and I want it to end, I don't like this. They're bringing Sunny back into because he is in there. He's trying to be born. That's the whole that's the whole reason contractions are happening, and it gets more intense. As it gets closer, it gets more intense. There was one mom that I remember when I walked in there, she was already at 5 centimeters. So 5 centimeters is active labor, I'll talk about in a moment. She was in pain. She was laying, I think, head down in her bed. Her husband was really supportive, was rubbing her back. The nurse was rubbing her back. There was another doula next to her. I walked in, I didn't have to say anything because she was being supported. I was just there, just being there for, until she got out of the bed. It took a while, but she was just saying, I'm in pain, I can't do this. Keep saying that to the dad. But that mom pushed her baby in a squat position. So she did it. So anyways, when I walked in, she was just in pain, and we were just there. Eventually she got out of the bed, and she did a position where she was just leaning over the bed and swaying her hips. And there was a point where what I felt like she needed to hear is like, I know that you don't want to hear this, but the more intense it gets, the closer you're getting to having your baby. I just said that because I felt like she needed to hear, like, you're almost getting there. And this is normal. It's normal that how she's feeling and how intense it is. This is progress. I didn't say all that. I just said that first part that I just mentioned. But sometimes women might need to hear something like that. When I talk about comfort measures, which is a different class, we talk about ways to support the mom. Some of them are words of affirmation and saying something positive, or some women don't want to hear anything and they just maybe want more of the actions. It just depends on the woman too. But there's times at labor that you might say something because it's needed, and there's times where you don't have to say anything. Like when I walked in, I didn't have to speak. She was being supported. She was good. She was in pain, but she was okay, and people were supporting her in that moment. And there was a time where I felt like, okay, let me just give her. Another thing I remember with that mom is that I just said, let's breathe. And she just started breathing. I never saw her eyes open until the baby was out. The whole time that I was there, her eyes were closed because she was in pain. But that mom was amazing, and her partner was amazing, and the support, she had her baby in squat position. That's pretty amazing.
Does sound matter, the position? Like, I heard that, you can have your baby, the most common one is laying on your back.
Mm-hmm.
But, like, if you feel like you can't, or that there's another position where you feel more comfortable, can you just, go that way, or has to be?
No, yeah, there's different positions you can do. It's just making sure that you have some in mind already. You have to share that with your partner, with the nurse. And then it's when you get to the hospital, sharing that ahead of time, because, when you get into the hospital, you're still okay, assuming that you're not about to have the baby right then, So you would mention it. You would have to communicate, like, I kind of want to push on, maybe you can push on your hands and knees, you can push on your side, you can push like that mom, but it does require people supporting you. And that means you share it with your partner, or you share it with, both. What was that?
Whenever you're comfortable with the position, I think, right?
The thing is, you have to share it though, because it also depends on the medical staff. You know, the hope is that the medical staff will be supportive. And if you're like, I want to push on my hands and knees, hopefully, you know, what I remember with a different mom is that when I got there, I think it was a mom that she got an epidural. I think it was the one I was talking about. She went from 4 to 5. She went from 30% effacement to 70%. I asked her at one point, how did you want to push? Do you have an idea? And she said, I just said, like, do you want to do on your side? Or like, what are you thinking? And she's like, yeah, I think I want to push on my side. So when the time came, I mentioned it to the midwife, like, I think she wants to push on her side. I also texted the dad, which I actually thought I was texting the nurse, but for some reason it was the dad. And I said, I think she mentioned she wanted to push on her side. So sometimes just somebody speaking up and saying, and the midwife was really supportive, and she's like, oh yeah, you know, and she pushed on her side, that mom. So it's informing people ahead of time, or maybe somebody reminding in the moment when pushing is coming. So when pushing is coming, you're gonna mostly be on your back because they have to check you. You're gonna be on your back, they're checking how many centimeters, and if they're like, you're good to go, you know, they're gonna motivate you to start pushing. And that's the moment where, you know, I said, Alex can be like, oh, did you want to still move to your side? You know, do you want to turn around? And you can say yes or no. It's up to you at that point if you want to move or not. Or hopefully you had already mentioned it to the nurse, and, you know, you could be like, hey, I think she wants to turn, you know, can we help her? Yeah. So, but like I said, it also depends. Hopefully you have a really good medical team as well that's supportive, and yeah, there's different ways you can push. I have a handout that I can share with you guys as well at the end that you can take with you if you like, and see that there's other ways. The thing about pushing on your back is it is very common, like you were saying, Jennifer. The only thing is that the tailbone doesn't go anywhere. So if you're on your back, it's pretty much going to be whatever opening is. If you push on your side or on your knees, the tailbone does move. The sacrum and the coccyx, it does move. So that's a benefit of, like, if you're on your knees or if you're on your side, you give space to the baby. And potentially, let's say you were pushing on your back for an hour, you know, or maybe getting to 2 hours. Maybe you're on your back, and then maybe you're like, maybe somebody tells you, you want to try something else? Do you want to turn to your side? And you're like, okay, you know, and then you turn. Maybe that's what baby needed to rotate, because this opened up a little bit, and rotate and then come out. The biggest thing is the head. That 10 centimeters is usually the diameter of a baby's head. Once the head is out, the body pretty much slips out. Yeah. That's a good question. Any other questions? No? Okay. We're almost there. I do have a video that I'm going to share with you guys. Just want to share a little bit of active labor before I get there. And by the way, if you guys need to use a restroom, you can go. You don't have to ask me as well. Okay. This is just, I already talked about early labor a little bit, but I'm going to just talk about the difference between the early stages to active. Early labor, where contractions are happening, they keep coming, they're a minute long. They don't go away with whether you drink water, you move around, they stay there, but you know, they have a pattern. What's going on is that your cervix is softening from 1 centimeter to 5. So it's going from 1 to 5. And that can take 10 hours, that can take 2 days, that can take 15 hours, just from 1 centimeter to 5. I'm just gonna give this so you have 2 of them. So from here to here. So from this one to here, that would be early labor. So really it's more softening and a little bit of dilation that's happening. It's not until you get to 5 centimeters that we're in active labor. And so this right here, the pattern that you see, it's early labor contractions, the one on the screen. So the contractions are there, right? They're maybe 45 seconds or 30 seconds. One happens at 5 p.m. The other one is at 5:30. The other one is maybe at 5:45. You know, they keep coming. Cervix is changing from 0 to 5 centimeters. When we go to active labor, This is the difference. So from this to this. So there's more intensity in active labor. That means that the contraction is, so early labor, mom is still talking. Mom is still, she's uncomfortable, but kind of what she was describing with her contractions before. She's uncomfortable, but were you talking to him when you were having them?
Yeah.
What were you saying?
Well, I was sending him snaps. I was just like texting him that it was hurting, but I even turned off the TV because it bothered me, like the noise.
Mm-hmm.
So I was just on my phone, like
Yeah.
it'll come and I'm like, just like breathe. But I was like, this is not an actual contraction because I do have a nurse who comes like every week.
Okay.
And she told me about it like 2 weeks prior and how they work. So I wasn't really like panicking or anything. I was just like feeling it and then counting them too because I had to watch.
Okay.
And then I was like counting how long they were.
How long were they?
About a minute.
Okay, so they were.
And they will come back. And so like
they kept coming, yeah.
And I was like focusing on, you know, what it was and how I was feeling. But I didn't really like ask her anything. I was just uncomfortable. Yeah,
and it's good that you were doing, like, you texted him or called him, I don't know, you turned the TV off, you know, and also that you didn't panic. You know, it's super important that you try to stay calm. It is a muscle, like the whole uterus and the cervix is a muscle, so you want the body to be as relaxed and as soft as it can be with contractions. And when we talk about comfort measures, it's trying to keep that, it is a physical process, but it's a mental process. So you did really good with mentality. You're like, yeah, this is probably normal. I'm just going to turn the TV off. I'm going to text him. Or did you call him? Just text?
No, I was
yeah.
I think also a video like that.
Yeah, I'm not going to do, like, you're just kind of passing the time. Early labor, you just want to distract yourself. Early labor, like I said, is the longest part of labor. Like, you could be there for 2 days. You can be there for 15 hours in early labor. That's why labor takes long, 24 hours. The first part of it can be the longest. It is the longest part. It's when your cervix is going from 1 to 5. And you don't really once you get to active labor, 5 centimeters, contractions are every 5 minutes, one after the next. You're not maybe going to send them a snapshot anymore. You're not going to, maybe you want to turn off the TV because it's more intense. So it's, you know, maybe you guys were talking about something before, you guys were joking or watching a movie, that's early labor. Once it gets more intense, you're like, don't talk to me, you know, or maybe you don't even have to tell them, you're just like, you know, you have to focus because it's more intense. It's a different type, you're dealing with a more intensity of contraction, and now it's coming pretty much one after the other. Usually there's 5 to 6 minutes apart. That's what we would say active labor. That would be the time that we're going to the hospital, that we're planning, we're getting our things ready. But you would want to let him know before you get to active labor. You know, if he's not around yet or he's working or somewhere else. Same with your support people. You want to let them know, like, hey, you know, I'm getting contractions, or I'm okay. You know, they're happening every, 20 minutes or 15 minutes. I'm fine, but I just want to let you know, that like things are happening. So maybe you want to start arranging and come home pretty soon so that they're aware. And then they're like, hopefully by the time that they're home, they're a little bit early, or they're kind of at the point where you're already having contractions one after the other, more intense. You're not going to measure yourself. Somebody asked me one time in a class, oh, would you measure yourself? I'm like, no, nobody should be measuring your cervix, right? Other than when you're at the hospital. But I've had that question before. But the way that you're going to have an idea where you're at is the labor pattern. And there's something called the 511. Have you guys heard of that? That's a way to count contractions. Yeah. 511. What do you already know about it, Jennifer?
My nurse told me, well, she explained me what you said first, that to know that the baby's going to come soon, it was by knowing that the mucus type of thing is going to come out. It's going to be reddish, brownish. That's an early sign of like coming. Then another one is the water breaking, and then it was also the belly dropping too as well. And then that part, where like, cause I was so curious, and you know, Braxton Hips, like
Hmm?
hip,
Braxton Hicks.
Hicks. You know what? I know the difference because how am I gonna know or like differ like which one is which? And then she told me that this one it's like yeah the timing it's in the belly,
Mm-hmm.
but this one is more like in the back.
Yeah,
and
all
then
around.
The inside like it starts like hurting, and then they're gonna come more often. Like it is like mine did lasted about a minute, but still like it went away, and this ones are just gonna be like
Keep
one,
coming.
another
Exactly.
one, another one, and it's just gonna be like stronger, and it's just gonna hurt more, and then that's when like, I mean, if the priorly like the water break or like it can come after.
Mm-hmm.
So she kind of has been like guiding me.
That's
that
awesome.
way.
That's good. Is it the Nurse Family Partnership? Is that the program?
It's from Medi-Cal.
It sounds like that program, the Nurse
Yes.
Family Partnership, where a nurse goes once a month or once a week or something,
Once
and
a
they.
week.
That's right. We're great. We're good information. So and then so she's talked about 511, and you from what you remember, what did she say about 511? Just so that I can kind of have an idea what you already know.
Oh gosh, I don't know exactly like because we talk about so many things all the time.
Okay, no problem.
5 minutes apart, 1 minute break.
5 minutes apart is that. Oh, so he was there too for the appointment. That's awesome. Yeah. So yes, and I'm gonna kind of review basically what it is. So when I would advise the support person to be the one counting. So we don't have to count the whole time. It's more when the contractions are intense, they're coming frequently. Mom is changing, her mood is different. Maybe before she was, I don't know, watching a movie with you, and now she's like that she doesn't want to focus, she doesn't want to see because she's dealing with an intense pain, more intense than before. If partner or support person notices those things, and they just notice like they're coming pretty frequently and she's in a different mood, the partner or the support can start looking at the time. They can do it with their time or their phone. There's apps that you can use, whatever works for you. But basically the way it would be is like, okay, contraction starting now. 12:12. So the support person is going to take track of that. It started at 12:12. They're going to count how long the contraction was with their phone, The contraction maybe they lasted 45 seconds. And then every contraction has a starting, a peak of intensity, and then it kind of goes off or down. The next contraction, let's say this one started at 12:17. Or actually, let's change it a little. Let's say this one was at 12:19. This next contraction, the support person partner was counting with their phone, and this one lasted a minute and like 30 seconds, let's say. The next one started at, let's say, 12:24. I'm just giving random numbers because labor is not going to be nice and neat. And then let's say that this one was 58 seconds. Let's say that the next one was at 12:31. And this one was about 43 seconds. The next one started at 12, let's say 38. This one lasted for 56 seconds. Let's say it was 12:43. And this one was for 1 minute. Okay. So how much time went from when the first contraction started to when the next one? 7 minutes. Really good with math right away. From this one to this one. 5 minutes. And then from 12:24 to 12:31. 7 minutes. And from 12:31 to 12:38, another 7. And then 12:38 to 12:43, 5. Okay. The first 5 is what Alejandro said. It has to be between every contraction, it has to be about 5 minutes. So most of them are close, 5 minutes, 5 minutes. These are not there, but they're getting close. The 1 means that every contraction has to be about a minute long. 45 seconds, 1 minute and 30 seconds, 58 seconds, 43 seconds, 56. They're pretty close to 1. The last 1 means that this labor pattern has to be happening for 1 full hour. So it started at 12:12. We're only at 12:43. That means that we can keep counting all the way until 1:12. Until we have an idea that this pattern is still this pattern, similar to this pattern, and it's been a full hour, then we can assume, okay, I think you're probably in active labor, which means that you're probably at 5 centimeters or close to that. So let's start going to the hospital. Because what can happen then, if this is not the pattern, let's say that, let's change it a little bit. Let's say that here was 15 minutes apart. Let's say that this one is 30 seconds. Let's change this one. Maybe 10 minutes apart. 36 seconds. So this is not 511, right? It's different. So even though there's a couple that have been close to 5 minutes apart, there's this space of gap is not 5. We have to be about every 5 minutes, close to every 5 minutes from one to the next. I had a mom in here that she was in early labor when she was here for a class, and from everything she described to me, it sounded like early labor. I wasn't worried about it. We did a class. She was with her partner. She started, when she would get a contraction, she would get up and start moving. And then I showed her, you can try this other position on the ball, and just kind of, and then I had the partner put pressure on her back, and, and
In the class?
in the class, she was here in a ball. I think I gave her a ball, I'm not sure, but yeah, I wasn't worried about it because everything she said sounded like early labor. So we talked about it, and she tried positions with her partner. And then I did, message the nurse just so the nurse is aware. They talked to the nurse. Her baby was born 2 days later. Her baby was not born that day. And that pretty much makes sense because that's a good example of what early labor looks like. She was uncomfortable, but, she was timing her own contractions. She had her phone on her. It was an app. She was leaning over it. She's like, if mom is still able to do things on her own in a way, and, basically have a conversation and talk, you're not in active labor yet. There's still going to be some time. And when I saw her pattern, because she shared that app with me, it didn't look like 511. It looked more like this. It's not 511. It looked like somewhere every 7 minutes, somewhere every 8 minutes, somewhere like 15 or 20 minutes. She had the contraction since like a couple of days before. So she was already, so that's what early labor takes a while. Every body is different, and every woman is going to be different. So when you get to the hospital, the hope is that hopefully that you timed them, or your partner helped you time the contractions, and maybe you are at the 511 now, you get ready to go to the hospital, and the hope is that when you get to the hospital and they check you, is that, you're close to or if you have it in front of you, that, you're at 4 or you're at 5. That's the hope. Because women can show up early if you were not in that pattern, and if you're at a 2 or a 3, they probably will send you back home, because it's like, no, it's not time, you can go home, unless they see something else that's like a reason they want to keep you, like a medical reason, like your blood pressure is high or your water is broken. If they see a reason that is medical, or that would be a reason that they might keep you, even if you're at 2 or 3 centimeters. But if everything is normal, and you're not at really 5 or 4, they're probably going to send you back home. That's the purpose of 511. That's a tool to kind of know, where am I at in labor, and is it time to go to the hospital now? It's the intensity and the frequency and how long it's happening for.
And also, like, something that my nurse has been telling know that, you know, because you can't eat, they basically take you in and then you're stuck and you can't leave. So she has been telling me that the more I can stay at home, the better. That way, like, whenever you just get to the hospital, you go straight into being in labor. Instead, you're just gonna be stuck there, no eating, nothing. And it's a lot different. And I've heard it too from another friend who recently had a kid too. That she waited and then she just went straight in and like it was like 2 pushes and then that's it. And then I feel like more shorter, like the amount of time in the hospital.
Yeah.
So.
Yeah, that's true. What you're saying is basically we kind of, the nurse and me are saying the same thing in a different way, but if you stay home in early labor, basically when you're having the early contractions and they're not at 511, you're gonna try to advance as much as you can in your home and be comfortable at home, because you can probably be advancing much better at home because you're in your comfort, or you're with your people, you're eating, you're doing whatever. When you get to the hospital, you should, it depends. You should, if you are not taking medications, you should be able to eat too. You know, I mean, I've been with a mom that she did mostly natural. I think she only did the nitrous oxide and she was eating. She was in probably early labor, but she was eating. So it's just that there's a point in labor that you don't want to eat anymore. More when you're in active labor, that you're just so focused on trying to have a baby and you're just in the intense, you're just so, that's not your concern anymore. But it's okay to eat. It just depends if you were getting an epidural or if you're gonna get a C-section, then they might say like, you know, you can't eat after this time. Even with an epidural, you can still have like some liquids like broth and juice and jello, but there's certain things that just for avoiding for you to like vomit or have nausea that they might tell you to stop.
I've heard that they have gone like when they're like 5 centimeters, they take them in. It took them like 10 hours to have the baby, and that amount of period you're not eating, you're not doing the nothing. So there some, depending on the hospital, I don't know, so having a Palomar, they either gonna let you or not.
Yeah.
So depending on your staff, how you say earlier,
The situation.
if they're gonna let you do certain things, so that's why like the most you can stay at home to you know, to go in and then you don't even know how long it's gonna take you for you to be fully dilated.
Yeah. Because it does depend. Like once, the hope is that when you get there at like maybe 5 or 6 or whatever centimeters, is the hope is that you keep advancing, and that's when you want to try to still, so that room where you're going to have your baby, that's going to be your space. So that's when it's more comfort measures, like, you know, you bring your support person, you bring your music if you want, you dim the lights, you bring a, if you want to bring a special blanket that, you know, think about things that are going to make you comfortable, and, you know, bring those things with you. Definitely your partner's probably going to make you comfortable, so you're going to bring, and then other little items like lotion. And that's your space. You know, try to make it is a hospital, but you're trying to make that space, you know, your, I don't know, like your little safe space and your happy place where you're going to have your baby. Because something that can happen is that maybe you're advancing so much at home, and then you get to the hospital, like what Jennifer shared, that some women might get at a good point, but then they're there for 10 hours. So sometimes moms, when they go with fear and scared and, oh, now it's real, then things can start to slow down. And that's when we call like the labor stalls. So like the cervix is staying at the same point. The baby, you know, like, so we want to try to keep that comfort that you had at home and bring it in some way to the hospital. And that's when we talk about more like comfort measures. That's why doulas are around, because doulas are part of that comfort. Doulas bring like oils for you to smell, and they massage you if you need it, you know, those kind of things. They show the partner, oh, you know, why don't you do this with her? Yeah, so because we want you to keep advancing, knowing that you're not in your comfort, you're in a hospital. And also the medical team is part of your team. So it's important for you guys to feel comfortable with the nurse, talk to them, communicate with them. And the hope is that you have a good supportive team. But if you don't feel like you're being understood or something's going on, you can request a different nurse too. So just, you know, also have that in mind, in a kind way, obviously, but hopefully that it doesn't come to that point. Yeah, so that's important. Another thing that Jennifer brought to mind that she is true, is eating is super important in early labor. When you're not at the hospital yet, even at the hospital, if you can have a little bit of snacks, but at home, it's super important to eat food, like even if you're not hungry. So, you know, eat together. That's what you're doing in early labor. Eat with your people, with your partner. Go for a walk outside, watch TV, watch movies. Just have you're basically trying to have it lighthearted. Don't focus on what's going on over here, because there comes a point in labor that it's very obvious that you're in pain, that you're in contractions. So before you get to that point, the goal of the support people is distract the mom with something else. You know, you can talk about the baby, how cute the baby's gonna be, how, you know, what color eyes, but let's not focus on the pain. Let's focus on something else. Keep your mind busy. Eat food, super important, what Jennifer said, because you don't want to get to the hospital, you haven't had any food. It's been whole like 10, 15 hours at home, whatever time. And now you're probably not even hungry, or maybe like Jennifer said, you can't really eat. And now you're don't have energy. You need energy. That's why food is important, because you need the energy to start pushing that baby and doing all those more active things. So thank you for bringing that up. I was forgetting about the food part. Okay, now I'm gonna show you a video. So I already talked about early labor and active labor. So what I'm gonna show you is we're gonna go transition and pushing. So what comes once, assuming that you're already at the hospital in active labor, transition, basically it gets more intense. Contractions are sometimes every 2 minutes. The contraction, you can see the difference in intensity here, right? And you'll see it here too. So you see the difference, right? Contractions can be about 2 minutes long. They're more intense. This is when moms can start to doubt themselves, when they're like, I don't know if I can do this. And maybe if you didn't want medications, this is when you might be like, give me all the medications, I'm done. But this is when they're really doubting themselves, because they're maybe at 8 or 9 centimeters. They're so close to almost pushing. So this is important for people, like everybody, to know, especially support people, because if we know that she's here, we need to motivate them, like, you know, really be there emotionally with them and be like, you got this, like, let's go. This means that Sunny is coming. And sorry, what was your baby? Ryan, that Ryan is coming. That's when you remind them. But it also depends. If you wanted medications, you know, that's a conversation for another time. But just know that this is normal right before pushing. And this only lasts, it could be a couple minutes to 2 hours, even though it's super intense. Your cervix is going from 8 to 9 to 10 centimeters. So I'm going to show you what that looks like.
Now let's look at the first stage of labor, which is when contractions rest as much as possible in between contractions. As active labor progresses, the baby starts a process called internal rotation, which helps her head get into position for birth. The baby's head turns so that the back of it is toward the front of the mother. This is called the anterior position and allows her to more easily fit through the pelvis and into the birth canal. In some births, the baby's head turns so that the back of it is against her mother's back. This is the posterior position. In this position, her head puts added pressure on her mother's back, which may cause back pain for the mother and slower progress. If your baby turns to the posterior position, you can try certain labor positions that use gravity and open your pelvis to help your baby turn to the anterior position. The third and final part of the first stage of labor is called transition, which is usually the most intense part of labor, but also the shortest.
The contractions seem like they're so close together, just like coming on top of each other over and over. So I happened to be in transition. I was excited.
During transition, the forceful contractions cause the top of the uterus to grow thick and strong enough to push the baby down. Contractions also cause the cervix to dilate completely from 8 to 10 centimeters. Due to the intensity of transition, it's common to experience hot flashes, chills, shaking, nausea, or vomiting.
She was starting to feel nauseous. I think Stacy and I were pretty much next to her bed the entire time until she was ready to push, just supporting her through the feeling of sickness.
Contractions during transition intensify quickly and might have 2 or more peaks. They last 60 to 90 seconds each and are 1 to 3 minutes apart, allowing very little time to rest in between. Transition usually lasts anywhere from 30 minutes up to 2 hours. Because of the physical challenges of transition and the length of time you've now been in labor, it's likely you will feel a mix of intense emotions, ranging from being confused to irritated to even angry. It's helpful to stay determined, knowing you are getting close to the pushing phase. Support people can assist mom in focusing during contractions by using direct eye contact and short to-the-point directions. They can also encourage her to rest in between contractions and give her extra emotional support to keep her from getting discouraged during this intense period. It may help to remind her that each contraction brings her closer to the birth of her baby.
The cold rack was great. I remember that too. You're so hot and sweaty. The cold rack was actually what I was focusing on. Was the coldness when it hit my body. So when we put that on, that's taking my mind off the pain a little bit.
After transition, labor progresses to the second stage, where you will push and give birth. Once your cervix is fully dilated, you might feel an urge to push right away, or your contractions might seem to slow down or stop for 20 minutes or more before you feel the urge to push. You can use this time to get some much needed rest.
Good, I feel like she's in a good position. Yeah.
Second stage contractions are less intense than transition contractions, but still powerful enough to push your baby down. They last 60 to 90 seconds each and are 3 to 5 minutes apart.
Would you like the ball?
The second
Would you like the
stage
ball
can be as
so you
short
can
as
sit on
20
it?
minutes or last as long as 3
You
hours
can feel
or more.
comfortable.
As second stage contractions build, most women feel a strong urge to bear down and push.
I do remember like feeling like the need to push and
Would you
like the
like
need
it
to
too?
just be done with it. And my body was like telling me to, so it was very much.
The mix of emotions you experience entering the pushing stage can be overwhelming. You might feel relief and energy from a second wind. Or, if pushing takes longer than expected, this excitement may be mixed with exhaustion and frustration. During second stage, partners can help mom change into comfortable, helpful positions. Second stage is also an important time for support people to provide focus and emotional support. Tell her you're doing great, you're almost there, or just a few more pushes, and remind her to rest between pushes.
I was really excited. It was a big moment.
I was very excited too, like all the waiting had paid off and all the pain had paid off.
By this point in labor, the top of the uterus is very thick and pushes on the baby with each contraction, helping the baby to move through the pelvis. This movement is called descent.
The nurse brought in the bar to use for pushing. And actually, I think the bar was really helpful. I liked that position a lot, especially because the midwives through all of our education and stuff talked about how important it was to make sure that I wasn't laying down so that my pelvic area was open and wasn't squished, because when you lay down it kind of makes your pelvic opening smaller.
Your healthcare healthcare provider might talk about your baby's pelvic station, which is the position of the baby's head in relation to the spines of the pelvis. The baby's position is measured in plus or minus centimeters from these spines. During most of the pregnancy, she is in the negative range. After lightening, she is usually even with the spines at the 0 station, and gradually during labor, she drops into the positive range. During second stage, the baby progresses to the +5 station for birth. As you push with each contraction, your baby's head moves down and then slips back slightly in between contractions. To help her head descend more easily, her skull is made up of separate bony plates that slide together to help her head fit through the birth canal. This is what gives many newborns a cone-shaped head for a few days or so after birth. The baby's head crowns when it stretches the vaginal opening to the fullest. This squeezes the head so it does not slip back anymore in between contractions. During crowning, mothers often feel a burning sensation in the perineum, the skin between the vaginal opening and the anus. After crowning comes the birth of the head. The baby extends her head and lifts her chin, allowing the top of her head to move out of the birth canal. Her head starts coming out face down and then turns to line up with her shoulders, which are still inside of her mother. With the next push, one shoulder comes out and then the other. After her shoulders are out, the rest of her body slips out and she is born.
I saw my baby and I was just like, oh my gosh, so this is over. But this little thing that wasn't here in my tummy is now out. And wow, but it was just such a great experience.
I remember like a shock. All this work, I got this little baby now.
After your baby's birth, you start the third stage of labor. If there are no complications, ask your doctor or midwife to lay your baby against your bare skin as soon as she is born. Holding her skin to skin right after birth helps her temperature, breathing, and blood sugar levels to adjust. You may notice that she calms down when she feels your warm skin. It's the closest thing to what she felt inside the womb. Skin-to-skin contact will also help both of you start breastfeeding. In fact, feeding her within the first hour of life has shown to have a positive effect on long-term breastfeeding and milk production.
Skin to skin was great. I felt like it was the right thing to do. They needed that bond, that instantaneous bond. I wasn't expecting the process to be like in the room. I thought it was going to be one of those like typical movie scenarios where they whisk the baby away.
A few minutes after birth, the umbilical cord is clamped and then cut. There are no nerve endings in the cord, so the baby doesn't feel anything. Intense labor contractions end with the birth of your baby, but after a short break, you'll feel milder contractions that will signal the delivery of the placenta. This happens about 5 to 20 minutes after birth and lasts only a few minutes. The shrinking of the uterus after birth causes the placenta to separate from the uterus. Once you push the placenta out, It will be examined by your healthcare provider, although you'll probably be paying more attention to your newborn. After you deliver the placenta, your healthcare provider will massage the top of your abdomen to help your uterus start to shrink and prevent too much bleeding. This massage can be very uncomfortable, so try taking deep breaths to help you manage the discomfort. The first few hours after the placenta is delivered is the fourth and final stage of labor, as you and your baby recover from labor and birth. During the fourth stage, the uterine muscle becomes firmer as it continues to contract. The uterus shrinks to about the size of a cantaloupe in the hours after birth. The uterus continues to contract and reaches its usual pear size about 6 weeks after delivery. You might feel mild contractions called after pains as the uterus returns to its regular size. These aren't nearly as strong as labor contractions, and they'll lighten up in a few days or weeks. Breastfeeding also helps this process along. You will have some normal bleeding from your vagina, which the nurse will monitor, along with your blood pressure and other vital signs. At the same time, your baby will also be observed periodically. In the third and fourth stages, your body makes hormones that help you bond and fall in love with your newborn. They also increase your urge to protect and nourish him or her. During this time, it's recommended that you and your baby remain together, skin to skin. The baby is usually very alert and wide-eyed at this time. You and your partner's loving attention helps your baby adapt to life outside the womb. In the hours and weeks after birth, think of mom and baby as one unit that stays together, just like it was during pregnancy. On top of helping breastfeeding, keeping mom and baby together with regular skin-to-skin contact helps the whole family bond.
Bonding with your baby and like her feeling you and you feeling my baby, it's just, well, I don't know, I just thought, well, this is mine. She is mine. So when I felt her and it was real to me, so that's what I felt.
Me hizo sentir así como completo, me hizo sentir esa parte que yo buscaba, que era la de sentirme padre.
You've reached the end of this journey through the stages of labor, and hopefully now you feel better prepared for your own labor. Remember that from the first signs of pre-labor through breastfeeding your newborn, your body is specially designed to give birth to and nurture your baby. Trust your own body and follow your instincts as you experience your own birth miracle.
Felt the bond right away with the baby. She was kicking me and she's poking me and wiggling inside of me, and then all of a sudden she's laying on my chest. It was great.
Looking back, I don't think I would have changed anything about my birth. I feel that I had a really good birth. It was an amazing experience for me.
I think next time, if and when we have another baby, I will be a lot better prepared and a lot less worried. I mean, there's nothing like the feeling of love between parents and their child. It's all consuming.
The best part about being a mom is having this little life in the world to support and love and just dote over, and just the love that you feel for him.
All right. What did you guys think?
I mean, it's a lot, you know. Every birth is completely different. Like, just like if I can have it in a few hours, she can have it can be longer, you know. The process is like different for each person, and like the procedure when I take you, there's no medication, it's a process, but I mean it ends up being like worth it, I guess.
It's emotional.
Yeah, it's a process, but I mean it's quite traumatizing how it comes out.
I saw
Gross,
faces.
too.
I did see faces like, oh, expressions.
I'm so glad I don't have to watch. I'm just you.
You're just doing the whole thing. Yeah.
Yeah.
Yeah. I mean, yeah, it is a long process, like you said, or it could be different for everybody. Here's what I can say, like what you said at the end, like it's worth it, remember that the goal is that baby is going to be in your arms pretty soon. And yeah, the good thing is you're not seeing what's happening, you're just doing the work, right? And just remembering that baby, Ryan, Sunny, it's coming, and that's their birthday. And so remembering that and holding on to that, even though it is an intense process, emotionally and physically, and you have time to prepare for it. I mean, this is just like a starting point, learning about the process and preparing mentally for it as well.
We need a lot of support.
What was that?
Yeah, a lot of support.
Yeah. So.
Things, I don't know.
Yeah.
The first and the second stage are very important, I think.
It has to do a lot with how the woman does it too, like how the woman sees it, and mentally and physically, but definitely the support, having a supportive team is important, like family and partner and medical, they're all part of your team. So it makes a difference when somebody is there with you, holding your hand or just next to you, versus when someone's on the side, on their phone and not being present. That's very different too. So having the right support does make a difference as well. But you guys are capable. I mean, the woman's body is designed to birth babies, and that's why all these things happen. So if you can hold on to that you can do it. It is, it's work, that's why it's labor, but it is possible to do. Yeah, but thank you so much for your time. That was a labor class. If you guys are interested in any of the other classes, before you walk out, on the sign-up sheet, there is a handout for the classes, and then there's the one for February, but there's going to be more for March as well. Some are group like this and some are individual. And there's other classes like baby care and breastfeeding and comfort measures, which are like techniques. What do we do now that we're going to be in the labor process? So feel free to put yes or no and take one of the flyers if you like. But thank you so much. And I do have flyers, so I'm going to put them there for you too if you like to take the flyers. Thank you.
Thank you.